Dr. Keene, thank you for your testimony, and I'm sorry that I'm a bit late. Another committee hearing that is just going on and on, but it's great to be here with you. I want to talk to you, if I could, about cybersecurity at rural hospitals. In Missouri, 40% of our hospitals statewide are rural. That's over 70 of our hospitals. We have seen multiple cyber attacks. In fact, over the last 3 years, 60% by one reckoning of rural hospitals in the country faced a cyber attack. But that's a very big number. There was a hospital near my state, Spring Valley, Illinois, St. Margaret's Health, that was actually forced to close its doors after a ransomware attack in 2021. So can you tell us a bit more about how cyber attacks on rural hospitals directly affect quality of care for the patients that they serve?
Thank you for the question, Senator. There's no question that cybersecurity attacks on any hospital, but particularly the under-resourced hospitals that typically serve rural populations, how this can be devastating. In the programs that we administer, we are laser focused on making sure that data is protected and that patients and that systems are secure. Our current HTI 5 rule is giving providers of electronic health record technology the opportunity to pivot away from box checking cybersecurity requirements to be consistent with the risk-based framework under the HIPAA security rule. As you know, the HIPAA security rule requires transmission security, audit controls, access controls, and the like. And we want hospitals to be able to adopt the most advanced sort of security postures to prevent these cyber attacks in the future. We would like the certification program to move at the pace of cybersecurity to assure that these sorts of attacks are rare, if ever happen.
Let me just ask you, in your own priorities in terms of in your role as the Assistant Secretary, how does rural hospital cybersecurity factor? And you said you'd like to see the protocols be changed, be updated to move with the pace of the threat. I mean, tell us a little bit more about that. What are you doing to see that effectuated?
Yes, our HTI 5 rule is updating the certification criteria so that it can adopt the most modern standards for cybersecurity. So, for example, in our current program, we ask people to say whether they use multi-factor authentication or not. And there are newer standards for cybersecurity that cannot be phished, something like the FIDO2 standard. And what we'd like to do is make sure that these newer standards can be adopted as they come out through our certification program. As a rural provider myself, I was in a situation for a cybersecurity attack happened at my hospital in Zanesville, Ohio, that shut us down for a day and a half. So I've lived through it, and I understand how serious these are, and I understand the problems with ransomware attacks. The attacks will always become more sophisticated, so we have to make sure that our cybersecurity posture and certification program keep up, and the flexibilities that we're introducing to be consistent with the HIPAA security rule will allow that to happen.
In June of this past year, Senator Hassan and I introduced a bill called the Rural Hospital Cybersecurity Enhancement Act, which this committee has passed unanimously. It's awaiting action on the floor of the Senate. What it does in part, and relevant part, is directs HHS to develop a comprehensive rural hospital cybersecurity workforce strategy, development strategy, that at a very minimum would consider public-private partnerships, development of training resources, and policy recommendations. Can I just ask you, would the development of a comprehensive workforce strategy like that help your office further its goals of improving quality of care and optimizing systems for rural healthcare providers?
Thank you for the question, Senator, and thank you for the focus on cybersecurity and also rural healthcare providers. I did it for the entire first part of my career. Anything that the Senate can do to help us improve the cybersecurity posture of all hospitals, in particular rural and underserved hospitals, would be helpful to HHS, and we're happy to provide technical assistance on any legislation that you're considering.
Good, very good, thank you. Well, I hope to see the bill pass the full Senate soon and look forward to working with you on that, and I'm sure other matters. Mr. Chairman, thank you again.